one of the studies among the VACCELERATE network. And as you may recall, this is a phase 2 randomized study to test different COVID-19 vaccines in older patients, 75 years old or older, already vaccinated against SARS-CoV-2, so to say a booster strategy. And in the first part, I'll just give some brief structural updates on the trial itself, and later I'll also give you a few results of the first part of this study to keep you updated on this too. So those are the partners involved. You may recall them. The sponsor is here, University of Cologne in Germany, the operational unit as well. And we have the biobank in Antwerp, the central lab in Dublin, while the virus neutralization assay is carried out in Antwerp now as well. And the cellular immunity lab is based in Madrid. So we have quite an international panel here. Just a brief overview on adaptations of the protocol, which are mostly affected by changes in vaccination policies. And that also includes main inclusion criteria. As already mentioned, subjects have to be 75 years old or older to be eligible for enrollment. And in part A of this trial, we evaluated a third COVID-19 vaccination with the mRNA vaccines by Pfizer, BioNTech, and Moderna in subjects that had already received a priming regimen of 2 doses of either one of the 2 mRNA vaccines or the AstraZeneca vaccine in a homologous scheme. And those were protocols version 3 and version 4. And as vaccination policies, you might be well aware of that, changed at the end of 2021. We had to adapt major parts of the protocol to version 5 and 6. And to name this the part B, where the 4th COVID-19 vaccination is evaluated in the same population, but with slightly changed time criteria regarding prior immunization, with the 3rd vaccine having been received at least 1 month prior to study entry, and the priming regimens with the first booster dose were also more heterogeneous, with still a homologous priming regimen of the first 2 doses, and then any of the mRNA vaccines as 3rd booster dose. And those were the major changes. We probably went through that already in the last meeting, but those are just some important things. And in the current version of the protocol, which is version 6, we only had to include some minor editorial changes and, of course, updates in the adverse events along the SMPCs of the investigational products, the mRNA vaccines by the 2 companies. And yeah, I'll give you a few updates on the enrollment process in a minute. Just to recall this, we randomized the subjects in a 1-to-1 fashion, and to receive either a Pfizer-BioNTech vaccine in the standard dose of 30 micrograms or the 100 microgram dose of the Moderna vaccine, which is actually considered a double dose, as the 50 microgram dose received a label after we developed the protocol, and the 50 microgram dose is actually considered the booster dose of this vaccine, but we decided to keep the 100 microgram dose as it appeared to be safe in all protocol amendments. And this might play a role later too. As I said, some updates on the recruitment status of this trial. I mentioned part A and part B, and part A also only enrolled at 1 study site here in Cologne, Germany, with 53 subjects enrolled in total. And then after the protocol adaptations, part B enrolled subjects all over Europe, in Germany, Lithuania, Norway, and Spain. And we are currently, we had enrolled 270 subjects in part B. That makes a total of 323, with a planned pre-planned sample size of 550. That means that only half of the planned subjects have been enrolled. And just a brief overview on the progress. There was an important sponsor decision at the end of 2022 due to adaptations of the mRNA vaccines by the companies themselves. As you may recall, now Pfizer-BioNTech as well as Moderna have adapted vaccines against the SARS-CoV-2 Omicron variants BA4 and BA5. And this would have meant to further amend the protocols and carry out major changes in the trial design, and therefore it was decided to close enrollment in 2022. We have the last patient first visit was in September 2022, and that means by November 2023, follow-up will be completed. The impact of the recruitment stop on statistics is, of course, an issue, and we thought a lot about this, and we decided to still keep this decision as our, just to summarize this slide full of text here, as our statisticians evaluated that the primary objective of the twofold antibody titer increase in all subjects after vaccination for each group will still be possible to evaluate with confidence intervals be a little wider due to the reduced sample sizes. However, they considered that the validity of the analyses will not be affected in a major way. And that is the current status of the trial. So enrollment is closed, and analysis of the part A of the trial is actually also finalized, and we already have this in manuscript form, which is under review. Therefore, we would like to keep those results, which I will present in a minute, confidential for now. And I'll give a brief overview on the key results of part A of this trial. As you may recall, we enrolled 53 subjects in this part, only at one study site between November 2021 and January 2022. And they were randomized 25 to the Pfizer-BioNTech arm and 27 to the Moderna arm as a third dose back then. One subject, you see 53, and this sums up to 52. One subject was randomized but did not receive the investigational product due to an acute SARS-CoV-2 infection on the day of planned vaccination, and two subjects were withdrawn during follow-up. So, as I said, the descriptive analysis is already done by our statistician in Vienna. And I'll jump over the objectives and endpoints because I think all of us here are quite aware of this, and you can also draw this conclusion from the results I will present. And I will also be brief on the baseline characteristics as we're short in time today, just to give you an overview that the two groups, despite the low total N, were well balanced regarding age, gender, and some other key characteristics. Also, the priming vaccine regimen was rather balanced in those groups, and in the continued baseline characteristics, we only considered the duration between the first and the second vaccination, and the second and the third vaccination, which was then the study vaccination, as well as the comorbidities, but I'll have a word on that in a minute. First of all, regarding the safety endpoints, as expected, pain and discomfort at the injection site was the most frequent adverse events in both groups. And I'll show you a profile of local and systemic reactions in a minute. Actually, the profiles were rather similar within 7 days after IMP administration. The most important or most common systemic reaction was fatigue. And as I already mentioned, the most frequent local reaction was pain at the injection site. And some things differed. We'll have a look on the on the diagrams in a minute. Myalgia was more often reported in the Moderna group, and actually the Moderna group had a higher median number of adverse events in total compared to Pfizer-BioNTech, 3.5 versus 2. However, there were no adverse events of grade 3 or higher related to the investigational medicinal product in this part of the trial, and no severe adverse events at all in those 53 subjects. This is just to display the grade of adverse events in both groups. On the left, the Pfizer-BioNTech group, and on the right, the Moderna group. So in the Moderna group, there were less subjects with no adverse events and more subjects with grade 2 adverse events, while grade 1 adverse events were rather balanced. Of note, we only included 52 of the subjects here, as the 53rd subject was the one who did not receive the study vaccination, just to be clear on that. Those are the maps with the adverse events. I really like those spider webs because it is easy to observe, and we can include a lot of information in those diagrams. And as I already pointed out, in blue we have the Moderna arm, and in red the BioNTech arm, the Moderna arm. Injection site discomfort, induration, pain, as well as fatigue were more frequent than in the Pfizer-BioNTech group. And those are the adverse events by organ system classes, which mostly, you see the number of adverse events is rather low here because all are in the 25% margin, and most frequently are musculoskeletal, connective tissue disorders, myalgia here to be mentioned, which was way more frequent in the Moderna group, and arthralgia and muscle spasms as well. However, there are no cardiac adverse events reported, which is important, as we observed a few cardiac adverse events in part B of this trial, and we had some discussions on this, but in part A, we did not observe any cardiac adverse events at all. One subject reported a worsening of a pre-existing cardiac condition, which was atrial fibrillation actually, but this was not considered related to the investigational medicinal product here, as this occurred many weeks after study vaccination. In this overview, this includes basically the same information as before, just maybe a little easier to read, but it's also more to read actually. And you can see it's rather balanced, but in the Moderna group, grade 2 adverse events were more frequently observed. Now, regarding the efficacy endpoints, which is also interesting, as you may recall, the primary endpoint was a twofold increase of the anti-SARS-CoV-2 receptor binding domain, IgG antibodies, and here we evaluated 25 subjects in both groups, as 2 subjects from the Moderna group had to be withdrawn during this part of the trial, and this is the day 14 data, so day 14 after study vaccination. And as we can see, and we're happy about this, fortunately, all subjects in both arms reached this primary endpoint, as well as an exploratory endpoint, which was a 4-fold proportion change of the anti-RBD antibodies. So this was reached by all subjects by day 14. We do not have the day 365, so after 1 year follow-up, data available at this point. This is still under analysis, but I think this is already interesting, that in an older population, this endpoint can be reached, and that there is a really an antibody response on the mRNA vaccinations. Those are some of the exploratory analyses. I won't show all of them because this is really also a matter of time, but I think this is of interest. So the geometric mean fold rise, kind of a mathematical thing here, but there's one interesting observation. So this was way higher in the Moderna group as compared to the Pfizer-BioNTech group, and this also played a role when we looked at very small subgroups, but the subgroups differentiated by priming regimens. So this means the priming regimen of mRNA vaccines, Moderna or Pfizer-BioNTech, and the AstraZeneca vaccine as a priming regimen. And here we can observe that the geometric mean titer by day 14 was much higher in subjects that have received mRNA priming regimen, especially if they received the Moderna vaccine as booster dose. So this was really higher than in the AstraZeneca group. Also interesting. This is an easier graph to show that all subjects had an antibody titer increase on a logarithmic scale here, but as you can see, all subjects here at baseline have an antibody titer increase. Yeah, I'll keep it at this because we already talked about this before. Because I want to show you some results on the viral neutralization assays, and we are very happy that we were able with our lab partners to evaluate viral neutralization assays in the wild type, which is on the left-hand side, and then basically all variants of concern, alpha, beta, delta, of course, in blue here, and then Omicron and subvariants in green here. And on the left hand side, we see the Pfizer-BioNTech group, on the right hand side, the Moderna group, and those are the seroneutralization capacities in percent at baseline, so before the booster vaccination within the EU-COVAT-1 study, and those are the results at day 14 after study vaccination. And it's easy to observe that there are highly responsive neutralization capacities in all subjects of note. As you can see, the viral neutralization capacity is higher in the wild type SARS-CoV-2 virus and the variants of concern that played a role a few years ago now. The capacities are a little lower in the green bars, which are all Omicron variants. Most interesting, maybe at the moment, still the BA4 and BA5 variants, which are here in the middle. But what is also interesting is that the Moderna group had almost in all, for all virus variants, higher neutralization capacity, as you can observe with the medians here. So this is it for now. We have more details in the results, but this is hopefully published soon. So then more results are available, and we are of course happy to discuss those. From part A, we are still missing the month 12. So after 1 year follow-up data of the lab data, so the antibodies and the virus neutralization capacities, as well as the cellular immune response by qPCR, and some further exploratory investigations in subgroups. But this is really something that is about to come. And of course, part B, which is actually still during follow-up, will provide data on booster vaccination in the 4th vaccination and a much larger sample, as I pointed out during the presentation. And I'd like to finish with this, and I'm happy to take